The U.S. Agency for International Development, the Ministry of Health of Uzbekistan, and the World Health Organization marked the World Tuberculosis Day in Uzbekistan by donating 60 gene expert diagnostic apparatus to the Ministry of Health during a ceremony dedicated to the event. More details are in our report.
Tuberculosis is one of the top 10 leading cause of death here in the world, killing 1.4 million people every year. The United States government, through AID, is actually the global leader in providing financial and technical assistance to countries like Uzbekistan, who are committed to ending tuberculosis and treating patients who have tuberculosis. Here in Uzbekistan, we have made great strides in coordination with the Ministry of Health and our implementing partners in WHO to fight tuberculosis, but still a lot has to be done, especially with the multi-drug resistant tuberculosis. AID has provided over $146 million to the health sector, the majority of which has gone to tuberculosis. Today, I'm very proud to have handed over 16 Gen Expert testing systems. In the last 6 months, this has brought our total contribution to 46 systems.
In addition to that, last year Usaid trained over 1,700 professionals on tuberculosis issues and screened over 3,000 at-risk individuals for tuberculosis. Usaid also works with other local and international partners to support the national TB program in raising public awareness. The U.S. ambassador to Uzbekistan has also attended the event, noting the importance of such investments into the health of Uzbek nation.
The importance that we attach to the work that we're doing with Uzbekistan on tuberculosis to fight and hopefully end tuberculosis someday is so important that Director Meredith of USAID and myself wanted to be here to mark the day. We can't change the date of World TB Day. It's the same every year, and we didn't know it was going to be the same day as this international forum. But we're here because the investment that is being made in the health and quality of life of the people of Uzbekistan through these programs is no less important than any other investment that we're trying to attract.
Gene expert testing is revolutionary, providing same-day test results so patients can start on treatment as soon as possible. Results from other test machines took up to 80 days. Gene expert testing checks not only whether a patient has tuberculosis, but also whether a particular tuberculosis case is resistant to antibiotic frequently prescribed to treat TB, allowing doctors to choose the medications that will be effective for the patient.
The mortality rates are reduced by 7% in Uzbekistan, and the incidence rate of the new infections of TB, the incidence rates, that's how we call it, has reduced by 4%. This is really good. The average reduction of incidence rates in the WHO European and Central Asian region is 5%, and we are having 4%, which is still good. At the same time, we have to be careful. The COVID has put a little bit of challenge globally, regionally, as well as in Uzbekistan. Because of this pandemic, we were all kind of paralyzed. And so for the future, we also have to think ourselves like, how can we better prepare ourselves for a new pandemic to ensure that the TB services will continue?
World TB Day is observed worldwide to raise public awareness of the devastating health and socioeconomic consequences of tuberculosis, which globally claims over 4,000 lives every day. The past 2 years have been especially challenging, with the COVID-19 pandemic hammering the fight to end tuberculosis, while Uzbekistan has made steady progress in decreasing total number of tuberculosis cases and deaths over the past decade. The proportion of more difficult to treat drug-resistant tuberculosis cases remain high.